Emergency Department of West Kendall Baptist Hospital. Introduction. Quality improvement initiatives in nursing are aligned with the National Quality Strategy goals of better care, healthy people and communities, and affordable care. Therefore, the participation of nurses in forward-thinking projects is key to refining the process of delivering healthcare in the U.S. Healthcare organizations around the country initiate quality improvement endeavors that increase patient outcomes by increasing the level of patient engagement, utilizing modern information technologies, IT, and reducing medical errors. The success of such projects is well documented in a wide range of healthcare institutions, which means that nurses should take active steps to improve the effectiveness of the services they provide. The aim of this paper is to outline a quality improvement initiative for the Emergency Department, ED, of West Kendall Baptist Hospital. The paper will discuss the benefits of the initiative, its cost, and outcomes evaluation. Discussion. Purpose. Numerous studies have demonstrated the adverse effects of ED overcrowding across a wide range of quality metrics. For example, the findings of a study by Sun et al. Reveal that patients who were admitted on days with high ED crowding experienced 5% greater odds of inpatient death. Furthermore, the study suggests that ED overcrowding increases the length of stay and costs per admission. It follows that by improving the efficiency of the national EDs, it is possible to ameliorate the negative outcomes of high crowding levels. The purpose of this initiative is to address the problem of ED overcrowding at West Kendall Baptist Hospital by changing the traditional approach to triage. The ED department of the hospital consists of 34 private examination rooms, 2 trauma rooms, and 2 isolation and decontamination areas. The hospital is one of 9 healthcare institutions in Miami-Dade County that has been certified as a primary stroke center by the state's Agency for Healthcare Administration. The ED of West Kendall Baptist Hospital had almost 64,000 visits last year. The ED healthcare services in the hospital are provided by certified emergency physicians, nurse practitioners, NPs, registered nurses, nursing assistants, and physician assistants, PAs. A high level of staff cohesion in the department will become an important asset for the implementation of the initiative. Target population. The target population for the Quality Improvement Initiative is patients of the ED who fall under 3 to 5 Emergency Severity Index (ESI) levels. The initiative will exclude pediatric patients from the department because 6 examination rooms for pediatric emergencies are located in a dedicated area of the hospital. The first and second ESI level patients will be barred from the pilot phase of the initiative because they do not pass through the triage area. These patients proceed immediately to a resuscitation area where dedicated providers evaluate them and initiate treatment and diagnosis within minutes. Patients experiencing behavioral health issues will also be excluded from the initiative. At West Kendall Baptist Hospital, such patients do not enter the department's main triage area. Instead, they are triaged at a behavioral health care area. All patients who are not covered by the exclusion criteria will be subject to the Quality Improvement Initiative regardless of their mode of arrival at the department. Description. There is ample evidence suggesting that the introduction of a senior emergency physician in the triage process substantially reduces the length of stay, thereby improving patient outcomes and increasing levels of staff satisfaction. Unfortunately, the limited resources of the department preclude the presence of a senior physician in its triage area. The initiative is based on the findings of a study conducted by Love, Murphy, Lietz, and Jordan, in which a nurse practitioner or physician assistant conducted an initial assessment in a triage area of an ED. To address the issue of crowding at West Kendall Baptist Hospital's ED, a nurse practitioner will be relocated to the department in the capacity of a triage liaison provider, TLP. The relocation will also change the current mode of the triage process at the hospital. The new triage arrangement will necessitate the presence of the following healthcare professionals: a TLP, a registered nurse, a patient care technician, an electrocardiogram technician, and a financial registrar. During the triage process, the team of healthcare specialists will evaluate arriving patients. Upon assigning a triage nurse to ambulatory patients, a TLP will conduct a medical screening examination, MSE. If a need arises, additional tests will be initiated by the team. After the assessment, patients with low ESI levels will be released to a waiting room. Benefits. The primary benefit of the initiative is to reduce the severity of ED overcrowding issues in the hospital. In terms of tangible results, the program will help to reduce the number of patients who leave without being seen, LWBS, and decrease the length of stay at the institution. Cost. The cost that will be incurred by West Kendall Baptist Hospital during the implementation of the initiative will be within acceptable budgetary limits. It has to do with the fact that the financial implications of the project presuppose the allocation of an NP and an electrocardiogram technician to the department. The healthcare practitioners will be needed during high-volume hours and will be reimbursed accordingly. The institution will be able to quickly recover its investment cost by reducing the number of patients who leave prior to MSE. Outcomes evaluation. To evaluate the intervention's outcomes, 2 performance benchmarks will be used. The first standard is door-to-physician time, which will be set at less than 30 minutes. The second benchmark is the share of LWBS patients, which will be set at less than 2%. Feedback. The Quality Improvement Initiative has been reviewed by the student supervisor, who stated that it is aligned with the hospital's mission to create a compassionate care environment. The supervisor has argued that the introduction of changes to the conventional triage process could be approved if formally proposed. The initiative's strengths indicated by the healthcare professional included the reduction of LWBS rates and its low cost. However, the supervisor has stated that the need to provide additional training to an NP appointed as a TLP is the initiative's weakness. Conclusion. The paper has detailed the Quality Improvement Initiative for West Kendall Baptist Hospital's ED. It has been argued that the introduction of an NP and an electrocardiogram technician to the triage area and the capacity of TLPs can substantially improve patient outcomes. The paper has also justified the cost of the project and showed that it falls within an acceptable financial range.